Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello again, everyone, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me again, round two, Dr. Patrick Tibbles. Nice to have you back, Doctor. Thanks for coming in and doing this. If anybody wants to know kind of the introduction to you in this podcast, they should go back to, I think it was episode 113, where we talked specifically on that episode about the hyperbaric chambers that you guys have at Monument Health that are helping people in a lot of different ways, right? Are these still important, big deal for you guys there? You're still using them quite a bit?
Yes, I remain the medical director for the past 25 years of our two single occupant hyperbaric chambers, and we're quite busy taking care of a variety of illnesses and patients in the Black Hills area.
I've heard, and I don't know if I'm just kind of correlating this now because I knew you were coming in, but over the last 5 days, I've had 3 conversations about the hyperbaric chambers here from different people in Rapid City, just out of the blue. People thinking or hearing about it. I don't know if it was from the podcast. That's where I'm going to believe it came from. It was you and me talking about it. But just these. So this must be something that is getting the attention of people here in Rapid City too, maybe.
It's certainly growing in popularity. Most of the expansion is actually into the aesthetic realm. And so while they are not associated with our chamber facility, there are private centers that are growing to treat different aesthetic types of issues.
Okay. Now, is this something that can be done outside? Can like private companies have these kind of things too to use?
Yes, there are freestanding facilities throughout the U.S. that support hyperbaric treatments for a variety of illnesses and aesthetic issues.
Sure.
Most of the sports teams, I think, the professional sports teams use hyperbaric oxygen therapy to help heal muscle and joint and bone injuries.
Well, we had our videographer had a great question when you came in here this morning about whether or not there's a hypobaric chamber. And you said, yes, such a thing exists.
Yes, hypobaric chambers are actually used for training purposes in the military, like the Air Force, to simulate altitude conditions for pilots in training. All
right. So this is that something down the road you could ever talk to on a podcast as well? I'm just fascinated by all of this technology. Doesn't matter what it is.
I would be happy to expand your world, Mark.
That would be great. Please do. You know, Doctor, you've had a pretty fascinating career. Obviously, you're an emergency medicine physician, and you were a medical officer for the U.S. Navy Submarine and Diving Force. How long was that part of your career?
I served in the U.S. Navy as an undersea and hyperbaric and diving medical officer for about 10 years.
So you spent time on submarines.
I took care of the. It used to be that doctors went out on submarines when the old diesel submarine boats and some of the newer nuclear submarines came out of the shipyards. But these days, most physicians, undersea medical officers like myself, actually just coordinate care on the different boats, as they're called, not submarines or ships, when they're deployed, when they're under the water. So while I've been on submarines and visited and did research on them, I did not deploy for extended periods under the water in a submarine.
That just seems the most unnatural thing we humans do, going into space and going deep underwater in a tube. And none of it terrified you?
It certainly is very challenging to be in an enclosed, confined space with atmospheric conditions that they are subjected to for long periods of time. But these wonderful sailors who give themselves to these missions are heavily trained and tested to make sure that they can survive and do their job under these conditions.
Did you ever have any really serious issues you had to deal with while you were there for that 10-year span? I mean, accidents that happened, divers or sailors that ended up, needing your specialties. Did that happen frequently?
It wasn't frequent, but on occasion we would have divers that suffered complications from diving in a pressurized environment, such as the bends, or an air embolism, where a bubble gets stuck in the spinal cord of the brain, and those can create very serious neurologic injury.
Now that's where some of these, like going back to the hyperbaric chamber, that's what those things are kind of for as well, aren't they? Because people have heard of the bends, is that what that is? That chamber?
Yes, that is the only treatment for the bends, for what we call a bubble disease.
Right.
When gas comes out of the tissues as a diver comes up to less pressure, though the nitrogen in the blood can travel around and stop blood vessels in anywhere in the body, from the heart, the brain, the spinal cord, and other vital organs.
And that can happen around here. You don't have to be near an ocean for something like that to happen, right?
Correct. We have treated actually some of our rescue divers on occasion for the bends who are practicing in Pactola or another lake as part of their search and rescue operations.
Oh, that's good to have you guys here then for that, because that's something I don't think a lot of people even think about in some instances.
Well, thank you, Mark.
Yeah.
It is a privilege to be able to have Monument Health support to operate what we have, which is a 24/7 program where we cover all hyperbaric emergencies around the clock. Me and my 14 board-certified emergency physician and hyperbaric trained partners.
Oh, wow. That's a huge team. Is it? I mean, that seems relative to Rapid City, that seems like a lot.
Well, they're all practicing emergency physicians, but also trained, and so they're kind of cross-trained, and that's how we were able to fill the gap and maintain this very increasingly rare type of facility where we have 24/7 coverage. I think there are only 40 chambers now in the U.S., chamber facilities that offer that.
Wow. So we are very fortunate to be living in an area right now that has a place like Monument that's expanding the way it is, right? It just seems like more and more we don't have to travel as much to get specialized help anywhere. We got it all right here in Rapid City. We've got a great emergency room department, as you very well know.
Yes.
You're the, like Hans said earlier, you're the front door to the hospital, right? You're the face we see when something really bad goes wrong, and it's nice to have you there. But there's a part of this, and kind of why we have you in here today, Doctor, is I think it kind of ties into this a little bit, and that is the Monument Health Foundation, which I know people have heard of, specifically with our group of radio stations, because every year we do the Children's Miracle Network. And the foundation, I know, is a big contributor to that. They kick in a lot of money to help that out every single year. And it's not something I think that a lot of people think about when they visit a hospital, but obviously it plays a huge role. So, in simple terms, what does the foundation do? How does it impact healthcare in the Black Hills here?
That's a great question, Mark. And after practicing for over 30 years in the emergency department, I was able to get involved through a very generous donation from a patient, a longtime patient of mine. And previously, I wasn't even sure what the foundation was or what it did. And then all of a sudden, I was introduced to the foundation and realized that this is a vitally important part of Monument Health's success and growth, keeping us local and providing those wonderful services that we're able to provide to everyone in our community.
Right.
It's a legal entity with a tax-exempt status that allows us to collect and distribute donations to our healthcare system and to other healthcare entities in the Black Hills to help them with vital resources and equipment, medical projects and services, and even research.
Mm-hmm. Well, you mentioned, and I know you can't go into a lot of detail about it, but you said it was a patient of yours that actually kind of set you up for this. Is that I mean, obviously you made a difference in this person's life, obviously, if they were going to do something like this. Do you see that happen quite a bit with stuff in the foundation? I mean, you're new to it all, of course, but is that kind of something that happens to a lot of you people that are involved with it?
That's a great question, Mark. Grateful patients are very much a part of the foundation donations and supporting the foundation. So we are, and when they are grateful, it spills over into the foundation, and that in turn means that we can take care of our community in a even greater way.
Right. Well, you are, obviously you're a doctor. Now you're an integral part of the Monument Health Foundation. Aside from this patient that you had, what else motivated you to jump into this?
I've been practicing emergency medicine in what I consider the greatest emergency department in the country, and I've practiced in others, and my daughter is a nurse in others.
Oh,
and
wow.
So her and I have agreed that Monument has really supported and built and helped us thrive as emergency providers. And however, it is a very demanding environment, and as I approached the end of my career, I felt I wanted to somehow, see if I could benefit the community in some fashion with my medical expertise and maybe a larger role, and help build a legacy for our community health care.
Now, are a lot of people, how many people that are part of the foundation are actual physicians?
Prior to this past couple years, there have been very few, if any, physicians involved. But thanks to the great leadership of our Chief Medical Officer, Brad Archer, and our CEO, Paulette Davidson, and Robin Zabrowski, our Chief Brand Officer, and of course our Director, Hans Nelson, they began to realize that adding medical direction to the foundation's vision and mission was vitally important to our community.
Well, that was my next question. Why is it important for doctors to be a part of this? Is it purely because you are you're the front line, you're the ground floor, you're seeing what directly impacts everybody from the foundation's donations? Would that make sense?
Absolutely. We're the ones that bring healthcare into reality and success in our community, and the support staff behind us, which includes the foundation, they needed somebody who was more on the front lines and could be a direct advocate with our community, and give leadership for the medical expertise for the projects and services they were doing, and just really elevate the foundation's mission and goals to a whole nother level.
So do you feel, are you comfortable with that? Do you feel like you bring that to the table, that you can sit in those meetings and you can say, look, this is what I've seen, and this is where a lot of this would benefit? That must feel good for you to be able to sit there and do that, like you said.
Well, Mark, my eyes have been opened in many ways, and I feel so grateful and honored at this stage of my life and career to be part of the foundation, understanding how it is incredibly vital that we have a foundation and that it is successful, and that increasing our donations level are going to be so important and make sure that our healthcare stays local, that we expand our services, and as you mentioned earlier, we continue to make this hospital system the only healthcare system that we need to get our care at.
Right. So obviously having a strong locally supported healthcare really benefits the Black Hills community then. It just kind of goes back to that. There's no traveling, for most of the things that happen anymore. We don't have to go to Denver or Rochester or Minneapolis for any of those kind of things. And I'm assuming that the foundation is a big part of that.
Absolutely. That just makes it so much less inconvenient and frankly less dangerous to have to life-flight patients to other facilities in other states in the middle of the night to get care that now we can offer here at Monument. And I'm just so impressed by the commitment of Monument leadership that they're working so hard to elevate this to the whole next level. I think even Mayo Clinic was so impressed with us that now we are part of their care network as an affiliate member.
Well, if you impress the Mayo, you're doing something right.
Yes.
I would think.
Yep, that's a feather in our cap,
right.
for sure.
Now beyond the foundation, are there other ways that you personally or you with the hospital are working to improve healthcare access and just healthcare quality here in the community?
That's a great question, Mark. One of the things that all communities struggle with is access to primary care and retaining primary care providers who really, as much as the emergency department is the safety net for unscheduled illnesses and injuries, primary care is the most basic model of keeping our patients from getting seriously ill and keeping them in wellness and medical prevention at the highest level. So with this help and support of Dr. Brad Archer, our Chief Medical Officer, I'm in charge of putting together or building a local clinic here that will employ primary care providers in a new model, a national model that we are partnering with out of Florida to improve our access to primary care, to improve wellness and prevention services, and to keep our primary care providers who are often overwhelmed with the volume of patients they have to see satisfied and engaged.
So this is not an urgent care. This is an actual clinic with just, if I'm simplifying this too much, with just more doctors. Is that kind of what this is turning into?
Well, you are correct that it is a separate clinic that is not specifically an urgent or emergent care center. It is a primary care clinic, but it's a specialized, very at high end, at the highest level of primary care with very state-of-the-art wellness and prevention services, and as well as primary care visits year-round.
So does that obviously bring in more doctors to our area too? Is that enticing to a lot of these doctors that might be looking to start a career somewhere?
Well, this is a new model for us, but we've seen this model in other states, and it does entice primary care doctors to stay in their profession, in their roles as outpatient physicians and providers and care for patients.
One thing I've noticed in hearing from you doctors over the course of doing this podcast is I'll ask where, are you from here? Where did you come from? And the question I'll ask is, well, you were in these cities like New York and Boston and Miami and Chicago. And there's places that all of us that grew up in these small town areas strive to get to vacation or even to live eventually because we think it's so much more exciting, right, than being here in western South Dakota, which, don't get me wrong, I love living here. I've spent my entire life here. But I hear so much from doctors that say, well, there's a reason why we come here and we want to practice here because we get to get involved personally with more of the patients that we see. It's not in, out, hurry up, this is the next one. We get to see these people sometimes from birth to the time they're senior citizens, right? Not quite, I suppose. No baby doctors at Monument, as far as I know. But is that an appealing thing for doctors to see or to come to Rapid City to do?
Yeah, one of those is the ability to have that kind of continuity of care from a young stage of life of a patient to their later years. But there are other important variables such as, look around us, the Black Hills, all the resources we have, the activities we offer, the restaurants, and other entertainment options in Rapid City. But I think more than that, because Monument Healthcare has grown and become more and more successful and does offer specialty services, this attracts other doctors to our area who want to be in that environment.
Does the foundation play a role in that too? Do they kind of do outreach to these doctors as well, in any sense, or is the foundation just mainly for what is already ongoing here in Rapid City?
The foundation has hundreds to thousands of projects that they contribute to, while directly involved in hiring doctors and enticing them to the area is not the mission.
Sure.
Creating an environment that entices them and retains them is very much part of the mission of improving healthcare in our area.
That makes perfect sense. What are some of the biggest opportunities for the foundation to make here in Rapid City for even a bigger impact?
Well, one of the most important ones right now is this the need for a new women and children's hospital. So because we have reached enough donations for probably close to the first time in the foundation's history, we can now initiate phase 1 of building that vital women and children's hospital.
Now, what is that going to look like? Why is this so important here?
We have had women and children's services here for decades. However, there is a great need to expand and improve the services that these populations need.
Okay.
We need a bigger neonatal intensive care unit, a bigger pediatric ICU. We need more inpatient pediatric beds. We need more specialized equipment for this that doesn't fit in the 1980s model that we currently have.
Right.
And our growing population also is bringing in kids. Some of those kids have special needs, and we need to step up and make sure that we have the resources to care for them.
Well, and I've had a Dr. Lemley on a couple of times here to talk specifically about the NICU and the PICU and things that we've and new what you're mentioning that's coming into Monument now. And it seems super exciting. I know he and his department, they're just giddy with what the foundation has helped these guys out with so far.
Yeah, Dr. Lemley is an absolute amazing medical director and visionary for pediatrics of all different types of services in our area. We're super proud and honored to have him here, and he like me, because we work together, are both very excited about the opportunities for pediatric and women's care in the Black Hills.
So you mentioned earlier that you're looking to wind this up, this whole ER doctor business that you're doing right now. What's are you just seen enough?
You know, Mark, I love the emergency department.
That's just it. You guys, every ER doctor I've talked to, you're such a unique breed of doctor, and you never sleep, it seems like, but it seems like you're always excited as the first day you went in there to you going in today. Does that still hold true for you?
Absolutely. I just, when you live in the land of what we call unscheduled visits, you have constant surprises, constant challenges, problem-solving needs that arise that sometimes you've never seen before, and you're really helping the communities survive. If we didn't have an emergency department, thousands and thousands of people would die or suffer needlessly every year. And to just have such a great emergency department and great colleagues who I work side by side with, and nurses and techs and registration people, and we're really almost in the trenches of America's war with itself and with each other.
That's a great way to put it.
And that is a great privilege, but also can really take its toll on you.
Yeah.
And I think that I would personally practice till I die in the emergency department, but I think as I get older, I realize that there are limitations in how fast I can move and put up with the wide-ranging shift schedules.
Right.
And so I'm hoping, and I have started to wind down, but I will always do some work in the emergency department. It's just so very near and dear to my heart. That's been my life's goal and mission, is to be part of that and build that and maintain that. And I want it for myself too.
Right.
As I age and require emergency department services.
You want to make sure, hey, that doctor I'm seeing better be as good as I was when I'm in there, right?
That's right.
Well, it is. I mean, a lot of people should feel super grateful, honestly, that you're taking your role out of the ER and moving it over to the foundation and bringing that experience in there that, like you've talked about now, can just add that sense of direction, that you being right there in the forefront of people at their worst moments, you can talk to the foundation and say, hey, this is maybe the direction it should go. This is maybe where some of that money should go, because I've seen it, and this is what's important. So for someone who's listening to this podcast and want to support healthcare, but not sure what they can do, monument.health/foundation. Well, you couldn't have made it easier than that, I guess. Perfect. Well, Dr. Patrick Tibbles, board-certified emergency medicine physician, thank you for coming in again and talking about this. Glad that you're going to be on this board. Hopefully, we'll get to work with you a little bit, too, through some of the stuff that we do here with Home Slice Media, so maybe we'll get to see you a little bit more. And, our favorite thing to do coming up May 9th is going to be the Children's Miracle Network, our mediathon that we do with them. And like I said, the foundation is such a huge part of that as well. And, when you see these stories of the families and the kids through that whole day, if it doesn't make you want to give, I don't know what's wrong with you. Right.
Very well said, Mark. Thank you.
All right. Well, yeah, thank you, Doctor. And anytime you want to come in, we're going to put together a whole show of just ER craziness at some point, because I can't wait to hear those stories. Thank you for coming in, Doctor.
You're welcome. Thank you so much for having me, Mark.